Dental implants are a superior method for tooth replacement. First, by replacing a single tooth or multiple missing teeth with implants, it is not necessary to bring down the adjacent teeth, as is the case with a fixed bridge. Secondly, when teeth are extracted, you will begin to suffer bone loss at the extraction site, but an implant will hold the bone and prevent the jawbone from dissolving away. When a fixed bridge is used, or when nothing is done to replace a missing tooth, the resulting bone loss at the extraction site will eventually affect the adjacent teeth, causing them to fail as well. An implant stimulates the bone, preventing bone loss. How long does treatment take for dental implants? Because the bone needs to grow to and bond with the titanium implant, called osseointegration, implant treatment requires at least 2 stages. If a patient is already suffering bone loss and is in need of bone grafting before implantation, treatment will take 3 stages. In the case of bone grafting, after the graft, it can take 3 to 6 months before implantation. Once implantation is done, it will take 3 months of healing time for lower jaw implants and 4 months for upper jaw implants. When the implants are healed and are solidly in place, we can do the final stage of placing the abutment and crown. Time required for individual treatments. For both bone grafting and implantation, usually the dentist will just need you in the office for 1 visit. A second visit the next day may be needed if you are having temporary teeth made. The final stage can take 2 or 3 visits over 3 to 5 days, depending on type of crowns and number of crowns.